Welcome back, everybody. April is here. April 1st today, and no joke, those shorts and swimsuit season will be here before we know it, and there's still time, though, to get those legs into shape. Dr. Bill Johnson of Innovations Med Spa knows the latest treatments to reduce cellulite. I love this. Good morning to you.
Good morning.
All right, we know cellulite, kind of, my dad used to call it hail damage.
Right.
What is it really?
Cellulite's that orange peel or mattress-like appearance that many of us get on mostly on the buttocks and thighs. It's much worse on women than men. And the thing to know about cellulite is it's really caused by the changes in the collagen tissue that supports the fat and not in the fat itself. So when we start trying to address cellulite, research has shown us that we have to do things that are going to affect the collagen tissue and not the fat.
Now, I thought you just had to live with it, but you say there's something you can do about it.
We can do quite a bit, and the best therapy we have today for cellulite is Thermage, and in particular the 16-centimeter tip. Now, Thermage uses radiofrequency heating.
Okay, so I was going to ask you, what is this?
Yeah, Thermage uses radiofrequency heating that actually heats the tissues deeply and heats the collagen, so it is affecting the cellulite at its source. And we get tightening and smoothing from doing the procedure. So not only will patients see an improvement in that texture, in that hail damage look, right, okay, but also we'll get buttock lifting and typically up to about 1 inch of decreased diameter in the thigh.
How long could something like this take?
Takes about 1.5 hours with the 16-centimeter tip, which is another big improvement. We helped Thermage introduce the 16-centimeter tip. We've done more than any other practice in the country. And we've gone from taking about 4 hours to taking about 2 hours to do the legs. So it's been a real improvement.
Well, yeah, and experience really helps.
Yeah, I had dinner last night with the head of Solta, who is the parent company for Fraxel and Thermage, and we are the #1 Thermage Fraxel practice in the country right now.
Which means you have the most experience.
Now these are some
before
and afters, and you can see some real difference in how the texture has changed in treating, and folks see some immediate change.
And how many times do you have to go back in?
Just once.
Really?
It's a single treatment.
That's after one time?
That's after one time. We do see a lot of the effect is immediate, and then we see further improvement going all the way out to 12 months.
All right, when we talk about using the 16-centimeter
tip.
Okay.
Now, the next thing coming down the road.
Right, I was going to say, what's next?
Yeah, we're just starting to work on what we're calling differential thermage, and right now we treat the whole thigh the same. If it's dimpled or not dimpled, it doesn't matter, we treat it the same. But where we're headed is to map out the dimples to actually show them, and here's a picture of a mapped out thigh. And then we treat differently on the dimpled areas versus the non-dimpled areas in order to get it a very targeted treatment in order to get the smoothest appearance. And we're working with Thermage right now very closely to figure out what's the best way to do this. So a few months from now or a year from now, this is going to be another step forward in how well we can smooth that out.
And there's another treatment you can do called fat transfer.
When we talk about really deep dimples, then we have to talk about filling that space. And fat transfer, we bring in fat from other areas to fill the space. And then another technology that really is great, fairly new, is fat shifting, where we actually take fat that's around the area and move it into the dimple. And here's a deep dimple.
I see.
And so we would take the fat from above and below that and just shift it. We free it up and shift it into the dimpled area so that when we're finished, the whole area is nice and smooth.
And that's a big difference between the mattress type appearance on the other one.
We can make a real big difference. Now, how do you know which one?
Right, that's the question.
Yeah, first, the best answer is to come in, let us do a consultation, take a look. But in general, if you have just a few very deep dimples, you're probably a good fat transfer or fat shifting candidate. If you've got a large amount of dimples or a lot of skin sagging, you're probably a Thermage candidate.
All right, well, thank you so much for helping us out. We'll be swimsuit ready before we know it. And for more information about fat transfer and Thermage for cellulite at innovationsmedspa.com, that's where you go. Just learn more about the cutting edge differential Thermage. Call 972-331-8844.